Dr. Deb Zeni, thank you so much for joining me today. I'm really excited to hear you speaking at our conference, and our theme this year is humanizing healthcare. So I was wondering if you could speak to why that is such an important perspective to consider.
In this time of COVID, I think humanizing healthcare has risen to be one of the top priorities that we're dealing with right now. People don't like being dealt with as numbers or hotspots or categorized in age groups. And a lot of people are finding it difficult to feel like they're being felt through virtual medicine. And particularly with COVID, one of the things which we've realized is that there's a lot of structures and hierarchical ways of dealing with things which come between the physician and the patient. And for healthcare to really work, there needs to be bonds of trust, and also people need to feel felt by the healthcare providers who are in front of them and who are working with them. And we've seen it splashed all across the news where this hasn't happened over the last year and a half. And I think it's time that we started seriously dealing with these issues.
Okay, thank you. I know that the topic you're speaking about is a challenging topic about abortion and informed consent. And I was wondering if you could tell me a little bit about how you developed your interest in this area.
My interest in dealing with abortion and informed consent really stemmed out of my personal experience and a passion to actually care for the pregnant woman with an unplanned or unwanted pregnancy. Those being both quite different, but also very intrinsically joined issues. Unplanned pregnancies are one thing. If the woman has a situation where she's going to be supported in going forward with her pregnancy, but there's a lot of times where it's unplanned. It's not necessarily, but the pregnancy isn't necessarily unwanted. However, there's an absence of support or very diminished support. Or in some cases, there's actually coercion going on. And this is where that human connection really comes in. If women have a healthcare provider, whether that's a nurse or a social worker or a physician, who sits down and actually says, what are the issues? What are your problems with your pregnancy? What are your fears? What are your anxieties? What are the obstacles to continuing with your pregnancy? It makes a huge difference for the mother who's pregnant. And seeing young women and older women and postmenopausal women coming into my office saying, I ended up having an abortion. It's like a big blur. All I know is I never wanted to have an abortion, but somehow it always happened. And now I feel terrible. And that's it's not good medicine. We can do better. And so I'd like to think that I'm one small mustard seed of doing better or helping to do it better.
I really like the way you put that. We can all be little mustard seeds. So what person or event has had the biggest impact on you in your professional career?
You mean with regards to informed consent and abortion, or just generally?
Just generally. I mean, I think you've had a really interesting trajectory and you have lots of things going on. So sort of who's had the biggest impact or...
I think one of the things which impacted me the most was when I was in my internship and found myself pregnant with an unplanned pregnancy. it was a good situation. Like, we had the support of both my parents, my husband's parents. I was married. However, we had these mammoth student debts. And at that point, there was no guaranteed leave for maternity leaves. And certainly within the medical community, there was no consideration for what would happen if a medical student or intern or resident got pregnant. There was absolutely no planning. And Dr. Bob Baer and the person who was the dean at that point sort of said, this is where the rubber hits the road in medicine. This is where we can show loving concern and kindness. This is where we can put our walk our talk. And so they carved out a maternity leave for me, which was paid. And they were extraordinarily supportive. And I thought, so it's a matter of paying it forward, seeing these absolutely amazing physicians become very personally involved to ensure that I was supported during the pregnancy and then afterwards. And for years and years and years, St. Mike's would have all the pictures of all the intern groups and everything over the years, many years. And the 1980 group is the only one which has a baby in it. And that's our eldest son, David.
Okay.
So
very good. So
he was really the hospital's baby.
Okay.
The chief of cardiology, cardiovascular surgery, would always come up to me and say, "How's our baby doing?" And everybody would look at me because he was sort of in his early 50s, and and they would wonder about what it was done. But it was really Bob Baer and the lead that he took, and the dean's actions, and it just made me think that you can really humanize healthcare at every level, and so I think that was the most telling moment for me and directive moment for me in terms of how I was going to do healthcare and how I was going to set priorities.